Have you ever wondered why you feel more tired than you should? Why you're waking up at night to use the bathroom? Or why your body just doesn't feel the same anymore, even though every doctor visit keeps telling you everything looks fine? What if I told you that nearly 9 out of 10 Americans with chronic kidney disease don't even know they have it, and by the time symptoms become obvious, a large part of the damage is already done, and often irreversible? I'm Dr. Johnny, and this is something most people are never warned about. Kidney disease doesn't usually announce itself with sharp pain or dramatic symptoms. Instead, it whispers. It leaves quiet clues on your skin, in your nails, in your breath, in how your muscles feel, and even in how exhausted you are after doing things that used to feel easy. And because these signs seem harmless or unrelated, they're often ignored until the kidneys can no longer compensate. But here's the critical part. If you know what to look for, you can catch kidney problems far earlier than most lab tests do, and that early awareness can mean the difference between preserving your kidney function and facing a future of medications, procedures, or even dialysis. In this video, I'm going to walk you through 10 warning signs of kidney disease that you should never ignore, signs your body may already be showing you right now. And stay with me until the end, because I'll also explain the one lab test most doctors don't routinely order, but absolutely should, if you want a truly accurate picture of your kidney health. Have you ever noticed a strange, almost chemical taste in your mouth that just won't go away, or a faint ammonia-like smell every time you breathe out? Most people dismiss it, blaming their morning coffee or the toothpaste. But what if I told you this could actually be your kidneys screaming for help? I'm Dr. Johnny, and the truth is, kidney disease often starts quietly, leaving subtle clues long before you ever see abnormal numbers on a lab report. One of the earliest, most overlooked signs is your breath. Here's what happens. Your kidneys are natural filters, constantly removing waste products from your bloodstream. When they start losing function, nitrogen-based compounds, things like urea and ammonia, begin to accumulate. Your lungs try to compensate, exhaling some of these wastes, and that's when you notice a weird smell or metallic taste. It's subtle, yes, but persistent, and it's far more common than most people realize. In fact, studies show that people with early-stage chronic kidney disease can already exhibit changes in breath odor, even when creatinine and other standard lab markers are still normal. Let's make it relatable. Imagine your body as a factory producing byproducts every hour. Normally, the waste is sent away efficiently, but when the filtration system slows even slightly, the smell escapes, reaching your mouth and alerting you before anything else. That's why noticing these tiny changes matters. And here's the kicker. The reason you can't ignore it is because breath changes often appear first, long before fatigue, swelling, or blood work abnormalities. But just knowing this isn't enough, because there's another, even more dangerous factor lurking silently. Right after we talked about how your breath can betray kidney stress, there's another subtle signal that most people completely overlook: waking up multiple times at night to pee, a condition doctors call nocturia. You might shrug it off, thinking it's just aging a cup of coffee, too late, or a small bladder. But when your kidneys start losing their ability to concentrate urine, this harmless annoyance can actually be a warning sign of early kidney disease. Here's the science behind it. Healthy kidneys carefully balance your body's fluids and salts, concentrating urine, so you don't have to empty your bladder constantly. When that system falters, your urine becomes more diluted, your bladder fills faster, and suddenly you're waking up 2, 3, even 4 times a night. There's more fluid that pools in your legs during the day, shifts back into your bloodstream when you lie down, and your kidneys try to clear it by making even more urine. It's like your body is doing extra work while you sleep quietly, signaling something is off. Think of it this way. Imagine a sponge that can only hold so much water. When it's saturated, every little drop spills over. That's exactly what your kidneys are doing, struggling to keep everything in balance. And studies show that people with early-stage kidney disease often experience nocturia long before blood tests reveal anything abnormal, making this one of the earliest signs you can detect on your own. So next time you're groggily trudging to the bathroom at night, pause and ask yourself, could this be more than just a minor inconvenience? And here's the hook that keeps it real. But just knowing this isn't enough, because there's an even more dangerous factor lurking silently that almost everyone misses. After noticing changes in your breath and waking up multiple times at night, Your fingernails could be quietly signaling kidney stress in a way most people never expect. Doctors call it Lindsay's nails or half-and-half nails, where the bottom portion of your nail appears reddish-brown, while the top near the cuticle looks pale or whitish. It's subtle, but for those paying attention, it's a clear indicator that something internal might not be functioning properly. Imagine looking down at your hands and seeing a subtle line dividing the colors, almost like a horizon line across each nail. It seems harmless, even cosmetic at first glance. But research shows that these nail changes often appear in patients with chronic kidney disease, sometimes even before lab results show significant kidney dysfunction. Scientists believe it's caused by altered blood flow in the nail bed capillaries and changes in melanin deposition, signaling that your body is struggling to maintain normal physiological balance. Here's a story that makes it real. A patient I once treated in their early 50s came in complaining of mild fatigue, but what caught my eye first were the subtle color changes on their fingernails. A simple lab test confirmed what their body had been hinting at all along early-stage kidney disease. This is exactly why knowing what to look for can give you a critical head start in catching kidney issues before they escalate. So next time you glance at your nails, pay attention. You might be seeing your kidneys trying to communicate a warning sign. But just knowing this isn't enough, because there's an even more dangerous factor silently building in your body that almost everyone misses. Just as your fingernails can whisper about your kidney health, your skin can shout warnings that are easy to overlook. Have you ever noticed patches of dry, scaly, or rough skin on your legs, back, or chest that just won't improve, no matter what lotion you use? It might seem minor, but for people with early kidney dysfunction, this is far from cosmetic. It's a physical sign. Your kidneys are struggling. Here's what's happening inside your body. Kidneys regulate minerals like calcium and phosphate, balance electrolytes, and filter toxins. When their function drops, mineral imbalances and waste accumulation can directly affect your skin, leading to dryness, intense itching, and even a condition called uremic pruritus. Imagine your body as a river system. When the filter is clogged, sediment builds up and begins to affect every downstream area. Your skin is one of the first visible spots where this sediment shows. To make it real, I once treated a patient who complained of relentless nighttime itching that had been bothering her for months. She had tried creams, baths, and even allergy medications with no relief. When we examined her labs, it revealed that her kidneys weren't filtering efficiently, and this buildup was the culprit behind her persistent irritation. It's astonishing how such a subtle signal can carry such vital information about your overall kidney function. And here's the thing, you might see this in combination with other signs like fatigue or changes in urine, but these early warning signals often get ignored until it's too late. That's why recognizing dry, itchy skin as more than just a nuisance can give you a real advantage in protecting your kidneys. But just knowing this isn't enough, because there's an even more dangerous factor silently developing in your body that almost everyone misses. After noticing dry, itchy skin, another subtle but powerful signal your body might be sending is unexpected dark patches or splotches, a condition known as hyperpigmentation. You may glance in the mirror and see your face, neck, or sun-exposed areas developing a slightly darker tone, almost as if your skin is carrying a hidden message. Most people dismiss it as sun exposure, aging, or even just genetics, but in reality it could be your kidneys quietly losing their ability to regulate hormones. Here's the science behind it. One of the hormones your kidneys help control is MSH, melanocyte-stimulating hormone, which regulates melanin, the pigment that gives your skin its color. When kidney function declines, MSH can rise, causing these darker patches to appear. It's like your body is painting a warning sign across your skin, signaling that internal processes are no longer balanced. Research shows that hyperpigmentation is particularly common in patients with chronic kidney disease, and it often appears alongside other subtle symptoms long before severe kidney damage becomes obvious. To put this in perspective, one of my patients in her late 50s came in for a routine checkup concerned about new discoloration on her arms and neck. What seemed like minor cosmetic changes turned out to be an early indicator of declining kidney function. Had she ignored these signs, she might have missed the critical window to intervene early and protect her kidneys. So the next time you notice unexplained dark patches, take a closer look at your overall health. You could be catching kidney trouble before it escalates. But just knowing this isn't enough because there's an even more dangerous factor, silently affecting your body that almost everyone overlooks. Following hyperpigmentation, there's another signal most people completely miss. Small crater-like bumps on the skin, medically known as acquired perforating dermatosis. These aren't just random pimples, they're your body literally trying to expel the buildup of waste products it can no longer process efficiently. Imagine your kidneys as filters in a river system. When the filter starts to clog, pressure builds and the debris finds alternative paths out. For your body, one of those paths is through the skin. Here's how it works as kidney function declines. Waste products accumulate in the blood and tissues. This irritates the skin, prompting it to push the damaged material outward. The result, tiny raised bumps with a rough center that appear mostly on the arms, legs, or trunk. While these bumps can also show up in liver disease, thyroid problems, or certain cancers, their presence alongside other subtle signs like unusual breath, nocturia, dry skin, and dark patches can indicate early kidney dysfunction. Let me give you a real-life example. A patient in her early 60s came in complaining about persistent small bumps she couldn't get rid of. Creams, ointments, and dermatology treatments did nothing. When we looked closer, her lab tests revealed early-stage chronic kidney disease. Those bumps weren't cosmetic, they were an early warning system her body was sending. The key takeaway, don't ignore these tiny, unusual skin bumps. They may seem insignificant, but combined with other subtle signs, they tell a story your kidneys are struggling to tell. But just knowing this isn't enough because there's an even more dangerous factor silently building inside you that almost everyone overlooks. After noticing those subtle skin bumps, the next warning sign may be even closer to home, a constant, unexplained fatigue that just doesn't go away. You wake up tired despite a full night's sleep, struggle with everyday activities, or feel winded climbing just a single flight of stairs. Most people blame stress, aging, or a busy lifestyle, but sometimes your body is actually signaling a problem with kidney function. Here's why your kidneys produce a hormone called erythropoietin, which tells your bone marrow to make red blood cells. Red blood cells are essential because they carry oxygen to all your organs and muscles. When kidney function declines, erythropoietin production drops, fewer red blood cells are made, and your tissues start to starve for oxygen. The result is anemia, and the fatigue can be surprisingly severe even if other lab results seem normal at first. To put it in perspective, think of your body as a city and red blood cells as delivery trucks carrying oxygen. When the production of trucks slows down, every area starts running out of supplies. Muscles feel heavy, your brain feels foggy, and your energy plummets. I had a patient in her late 50s who came in convinced she was just burned out from work, but a simple check revealed her kidneys weren't producing enough erythropoietin, early anemia, due to CKD. Once identified, treatment and lifestyle adjustments made a huge difference. So if you find yourself struggling with constant fatigue without a clear cause, don't ignore it. Your kidneys may be quietly losing function. But just knowing this isn't enough because there's another even more dangerous factor silently developing in your body that almost everyone misses. After persistent fatigue, another warning your body may be giving you is muscle soreness, tightness, or sudden cramps, especially at night. It might seem random, you go about your day normally, then wake up with painful calf cramps or achy muscles for no apparent reason. Many people dismiss it as aging or overexertion, but in reality, this can be a subtle yet serious sign that your kidneys aren't regulating electrolytes properly. Here's the science behind it. Your muscles rely on a precise balance of sodium, potassium, calcium, and magnesium to contract and relax smoothly. When kidney function declines, this balance starts drifting out of the optimal range, causing muscle cells to misfire. Even minor fluctuations can trigger cramps, soreness, or feelings of weakness. Think of it like a piano where the keys are slightly out of tune, every note feels off, even though the piano still looks fine. I remember a patient in his early 60s who had been experiencing calf cramps nightly for months. He had no other symptoms that seemed serious, and his doctor initially attributed it to dehydration. But lab tests revealed subtle kidney dysfunction affecting electrolyte levels. Once identified, adjustments to diet, hydration, and monitoring electrolyte balance made a noticeable improvement. So if you're noticing unexplained muscle aches or nighttime cramps, it's not just random. It could be your kidneys quietly losing function. And here's the mini hook to keep you watching, but just knowing this isn't enough because there's an even more dangerous factor silently developing in your body that almost everyone misses. After experiencing muscle cramps and soreness, the next warning sign is muscle wasting, a more serious and often overlooked consequence of declining kidney function. This isn't just the occasional weakness, it's a gradual breakdown of muscle tissue that can affect your strength, mobility, and overall quality of life. Many people dismiss mild muscle loss as aging, but when kidneys are involved, it's a red flag that systemic damage is occurring. Here's why it happens when your kidneys lose function. They struggle to maintain proper acid-base balance in your body. As acids accumulate in the blood, your body begins breaking down muscle tissue to buffer these excess acids. On top of that, chronic kidney disease triggers inflammation, oxidative stress hormone imbalances, and vitamin D deficiency, all of which impair muscle regeneration. The result is a domino effect where strength, metabolism, and energy levels gradually decline. To put it in perspective, think of your body like a house under stress. The foundation, the kidneys, starts to crack, and slowly the support beams, your muscles, begin to weaken one by one. I once treated a patient in his mid-60s who had been attributing general weakness to getting older, but lab work and physical assessment revealed muscle wasting caused by early-stage kidney dysfunction. Early recognition allowed us to intervene with dietary adjustments, targeted exercise, and careful monitoring, helping preserve his remaining muscle and kidney function. So if you notice unexplained loss of muscle mass or strength, it's more than just aging. It could be a warning. Your kidneys are silently struggling. But just knowing this isn't enough because there's an even more dangerous factor quietly building inside your body that almost everyone misses. After understanding muscle wasting, it's time to recognize the most alarming and comprehensive warning, the domino effect of kidney dysfunction on your entire body. By this stage, declining kidney function doesn't just impact one system, it begins to cascade, affecting your muscles, bones, hormones, immune system, and overall organ health. What may have started as subtle fatigue, dry skin, or nighttime cramps now compounds, creating a silent storm that is easy to ignore until the consequences become severe. Here's the science behind it. Kidneys are central regulators of fluid balance, electrolytes, hormones, and waste removal. When their function drops, acids accumulate, electrolytes fluctuate, and vital hormones like erythropoietin, vitamin D activators, and growth factors are thrown off. This creates a ripple effect. Muscles weaken, bones become fragile, immune response diminishes, and inflammation rises. Studies show that late-stage chronic kidney disease impacts nearly every organ system, and recovery becomes exponentially harder once the damage cascades beyond a certain point. To illustrate, consider a patient I saw recently, a man in his early 60s who had mild early symptoms like fatigue and subtle skin changes. By the time his kidney's filtration rate had declined significantly, he was facing muscle wasting, elevated blood pressure, electrolyte imbalances, and weakened bones. What started as almost invisible signs had snowballed into a life-threatening chain reaction. This is why recognizing the warning signals early isn't optional. It can literally change the trajectory of your health. So if you notice multiple signs together, breath changes, nighttime urination, nail or skin changes, fatigue, cramps, or muscle loss, don't ignore them. And remember, while these 10 warning signs are critical, there's one last insight you absolutely must know that could determine whether you avoid dialysis entirely. Stay tuned until the end. As we've walked through these 10 warning signs of kidney disease together, I want you to pause for a moment and really consider what your body may have been trying to tell you. It's easy to dismiss fatigue, dry skin, unexpected changes in your nails, or nighttime trips to the bathroom as just getting older or part of life. But these signals are your body's way of sending an urgent message. Your kidneys are quietly working every second to filter waste, balance electrolytes, regulate hormones, and keep your body functioning smoothly. And when they start to struggle, subtle clues appear long before obvious symptoms. Recognizing these signs early can literally change the course of your health. You have the power to intervene before serious damage occurs, and that's why staying informed and proactive is so important. First, let me reassure you, noticing these signs doesn't mean you're destined for dialysis or severe kidney disease. Early detection, lifestyle adjustments, and working closely with your healthcare provider can preserve kidney function and often slow or even reverse the progression of damage. Focus on hydration habits, balanced diets, limiting excess sodium and processed foods and regular checkups, especially if you notice multiple warning signs. And remember, even small changes like monitoring nighttime urination patterns, paying attention to subtle changes in your skin or nails, and scheduling routine lab tests can provide powerful insights into your kidney health. I also want to emphasize the importance of regular lab monitoring. While many doctors routinely check creatinine adding tests like cystatin C can give a much earlier and accurate picture of your kidney function, it's not about causing panic, it's about empowerment. Knowledge is your most effective tool when it comes to protecting your kidneys, and acting on it early can prevent complications that would otherwise take months or years to address. I care deeply about your health, and I want you to feel confident in taking these steps. This video isn't just about information, it's about giving you actionable tools to protect one of the most vital organs in your body. If anything you've heard today resonates with you, take a moment to pause, reflect, and consider what changes you can implement right now. Even small, consistent actions can make a meaningful difference over time. To make sure you never miss updates like these, and to keep receiving the latest medical insights and kidney health tips, make sure you save this video for reference and subscribe to the channel. Turn on notifications so you're alerted every time we release new content aimed at keeping your kidneys healthy and your overall health thriving. Your engagement isn't just about staying informed, it also helps us create more content tailored to your needs and concerns. And if you've experienced any of these signs yourself or found the tips useful, leave a comment below. I read every comment, and your questions could help guide future videos to provide even more value for the community. Finally, I want to leave you with a message of hope. The human body is incredibly resilient, and your kidneys can often recover, function, or maintain health if you intervene early. Recognizing these subtle signs, taking timely action, and committing to lifestyle habits that support kidney function can make a real lasting difference. You are not powerless by paying attention to your body and staying proactive. You are giving yourself the best chance to protect your kidneys, maintain your energy, and enjoy life fully. Remember, kidney disease doesn't always announce itself with alarms, but now you have the knowledge to listen to your body, spot the signals, and take action before it's too late. Stay vigilant, stay informed, and know that each step you take today builds a healthier tomorrow. Thank you for watching, for caring about your health, and for taking these small but critical actions to support your kidneys.